Hi, everyone. Welcome to the Lakeview podcast series. I'm pleased today to be joined with Carrie and Scott Smith with Brightside Sober Living in Austin, Texas. Good to have you guys here.
Thank you.
We're really excited to hear about the services that you offer for sober living and now new transitional living or structured extended care. So I'm curious, before we get into the details of that, how both of you got into the field of addiction treatment. What was it that prompted you to say this is something we need to do?
Well, Carrie and I actually went through sober living at the same time, got sober close to the same time period. We each spent close to a year in sober living. It was some of the most important time in our recovery. We found that gaining that support system in early sobriety was super important to our recovery, as well as learning to become self-sufficient. So when we got around, I was around 5 years sober, Carrie was just over 4 years sober. We had, obviously continued our relationship and got to a point where we had become financially capable of opening a sober living home. We actually opened our first one in 2010, and that was a men's home. It took us a couple of months to fill that up, but once it got full, we realized how big of a need there was. We did this based on our experiences with sober living and what we found to be really helpful, and the things that we found that were lacking, we tried our best to correct how we knew that it could be better.
What sets your programs apart from other sober livings, do you think?
We are, one, in a financial way, we are separate from most. We are at a $5.90 a month price point. We keep that price point specifically so people can be self-sustaining, even with those entry-level positions as they get sober. We encourage that all people have to be full-time employed, or part-time employed or full-time student.
Okay.
We are fully 12-step based. We have on-site house managers, all which are volunteers. Must have completed their 12 steps, working with a sponsor. We preferably actively sponsoring at the time, and we ask for a 1-year commitment. So we don't have a lot of rollover of staff. Carrie and I are directly involved with all of our houses. We have 6. We have 4 men's houses, 2 women's.
So there's a nice intimacy there.
Absolutely.
Where they have consistency, which is really important.
It is truly a family environment.
Great.
Not only within each house, but within the whole organization. Very much feels like family. We do a lot of events.
Great.
Cookouts. Several of the houses have swimming pools, so we do a lot of, in the summer, it's a big thing for us. The community in Austin, recovery community, is amazing. And we really see our people go on to get connected to home groups and stay local.
Great.
A lot of our alumni have ended up, working in the treatment industry. We're seeing a lot of that.
And you all have a new program that you just launched in August called the Ascension House, which is structured extended care. Can you speak just real quickly about what that program is about?
Sure. Ascension House opened on August 1st. This is a 30, 60, or 90-day program for women. It is designed to work on trauma, codependency, 12-step, and a controlled... Let's pause this up. So Ascension House was opened on August 1st. Carrie and I have found through our experience with sober living that some people are just not prepared to transition directly from treatment into a less structured sober living environment. Some people are not ready to be connected with the opposite sex, for instance, or have some emotional stuff that still needs to be dealt with. Ascension House is designed as a 15-bed house for women, where women can get connected with other women, can have the supervision and accountability that they need to learn how to live in a community, but not have some of those distractions quite yet. And as they face that system, our goal is to have them work through all the 12 steps, be actually attending meetings in the community, as well as doing their PHP treatment and IOP treatment as a step down through Rock Springs Behavioral Health in Georgetown. They are transported by us or by Rock Springs to their clinical, as well as anything that they do. We give them gym memberships. It's a pretty exciting deal.
Sounds like it's going very well so far.
It's
That's
exciting.
Really good.
They have a chef.
That's awesome.
I wish I could live there.
I know. We all need a place to take a break.
It is a super nice property.
Very good. Well, I'm really impressed with what you all have accomplished. Obviously, you created some wonderful roots in Austin for the sober living community. It sounds like what you're going to be offering from the treatment side is going to be even more powerful. And so we're grateful that you've had a chance to spend some time here in Jacksonville. If anyone wanted to access services, whether it's at the sober living programs or the new extended care program, how could they get in touch with you all?
Well, we have two websites. BrightsideSoberLiving.com is our sober living environments for men and women. And then Ascension House is theascensionhouse.com. Our phone numbers for men for Brightside, mine is Scott Smith at 901-626-4454. Carrie's is 901-604-0520, and we can answer any questions about either facility.
That's fantastic. Well, thank you both again for taking the time to visit with us. For those of you that are interested in learning more about Lakeview Health, we invite you to visit us at lakeviewhealth.com.